The National Assembly Health Committee has adopted the Kenya National Blood Transfusion Service legislative proposal of 2019 and has pledged to fast-track it into law to cure the ongoing acute shortage of blood in the country. Well, this, however, will only happen at the earliest by April next year to allow for a budgetary allocation for blood services in the 2020-2021 financial year budget. Dorcas Wangira with more.
What will it take to streamline Kenya's national blood transfusion service? Stakeholders drawn from both the private and public sector drafted the Kenya National Blood Transfusion Service legislative proposal bill of 2019. The bill saw the existing gaps in legislation and the lack of clear regulation in activities relating to blood donation, such as testing, processing, safeguarding, transfusion and quality control. All this coupled with the fact that Kenya has never met its blood bank targets.
The community have come up with a draft bill. All those issues are addressed in that bill. We're looking at a structured institution which is managed professionally, that has a board.
But this is not the first attempt to mainstream blood donation and transfusion in the country. A similar bill was introduced in 2015 but failed. 2017
Health Act, there's provision, and that's the good news. The government did put provision of enactment of a Kenya National Blood Service under an Act of Parliament.
It still wasn't enough to have a sustainable blood service in the country. Funding for blood services was largely coming from the American taxpayer-funded PEPFAR program. This was estimated at 7.25 billion shillings annually for the entire program and 2 billion shillings for blood services. The funding folded in September 2019 and exposed Kenya's underbelly.
The donors are not pulling out because they don't have confidence in the country. Is a policy within themselves. And the first policy is that Kenya has moved its status from low-income country to a higher income country.
It's futile to expect that foreign taxpayers are going to pay for services that essentially are Kenyan services.
The Kenya National Blood Transfusion Service Bill 2019 seeks to have the Kenya Blood Transfusion Service as a national service. It will set standards in respect of blood donation, recruitment, collecting, distribution, as well as disposal of waste blood. The bill also provides for financial provisions for the blood service. It further provides for the role of the county government in blood transfusion. Provisions are made for the management of the service, including administrative procedures for those aggrieved by the decisions of the board, and most importantly, it provides for the rights and responsibilities of blood donors.
It's timely. This is in line with the Health Act 2017. The ministry has tried to really look at the Health Act, but there are so many things that need to be implemented.
Hope is that that bill will be passed through by parliamentarians, and of course what that would mean is the government or the exchequer would put in money towards supporting this service.
The bill could be passed into law at the earliest in April next year, and funds for the blood service set aside in the year 2020-2021 budget in June next year. Stakeholders in the Mombasa meeting proposed that it be fast-tracked into law. Another alternative would be to ask the Ministry of Health to prepare a supplementary budget to fill in the gap left by the withdrawal of donor funding. For the time being, facilities such as the Jaramogi Oginga Odinga Referral Hospital will not hold all complex surgeries due to the acute shortage of blood, reflective of a problem that affects the entire country. Dorcas Wangira, Citizen TV, Nairobi.